would like to call the village board meeting for the village of Ashwaubenon to order for Wednesday, December 10th, 2025. Roll call, please.
President Kardasky.
Here.
Trustee Paul. Here. Trustee Atkinson. Here. Trustee Krieger. Here. Trustee Fluke. Here. Trustee Service and Trustee Zerbal are excused.
Please stand for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And please remember our men and women throughout the world in uniform. Okay, we are going to be having a roundtable discussion with service providers regarding housing and homelessness in Ashwaubenon and the greater Green Bay region. What I would like to remind everybody before we start, though, to please, if you're going to say anything, please use the mic because the meeting is recorded and we need that for the recording and the people online can hear. So I'm going to, Josh, you wanted to come in and talk about this? So
yes,
it's yours.
So I'll introduce myself. I'm Josh Benty. I'm the Housing Initiative Project Director, or Homeless Initiative Project Director for the Greater Green Bay Blueprint to End and Prevent Homelessness. I work closely with our Brown County Housing and Homeless Coalition. I have some of the members of our executive committee there with me and some of our service providers that are part of our coalition as well here to share some of that. So I'll have them introduce themselves shortly. So here's Shannon.
Hi, thanks for having us. I'm Shannon Wienant. I am on the executive committee of the coalition and also work at House of Hope Green Bay.
Tony Schneider, also on the executive committee, and I work at St. John's Ministries in Green Bay.
Patrick Leifker, also on the executive committee, and I work with the Brown County Housing Authority.
Thank you. Before we start, I guess I would like to say, I would like to know and better understand what each of your organizations does to enable people to get out of homelessness, to end homelessness for the individual. That is what I'm hoping to gain out of this. So I don't know if anybody here has anything.
Question I'd have is,
put your mic on green, Gary.
there we go. Question I'd have is, why are they here? What are we inviting them here for? And if anybody had any brains with the weather we have here, you'd be definitely down where it's warmer.
Yeah, Gary, I can probably best answer that. So if you recall, back at the end of October, there was a proposed ordinance related to a camping prohibition on public property. It was part of the motion at that meeting to deny the ordinance, but to bring forward members of the service provider community, if you will,
Right.
to have a roundtable discussion with the board about what services they provide, I guess the impacts of the housing crisis and the homeless population within the greater Green Bay, Brown County, Ashwaubenon area, so that you have a better understanding as a board, so that in the future, if policy proposals are being presented to you, you have some information and knowledge as to the impacts that those proposals may have on that population. That's really the basis for today's meeting.
Okay.
Could I see one of the agenda packets? I want to make sure.
I think one of the things that I'm very interested in is, we as a village board have to always be balancing, what our residents want. And then, of course, we do have homeless people who come into our village, and okay, we want to respect them. We want to make. I am very interested in what are the resources that can help us as a village to get them to the right place. We don't have those resources here. We don't get the money funneled to us here at the village level. Therefore, for us, we're always kind of stuck with, okay, how do we manage this? What do we do? And it can happen any time of the day. It can happen at 9 o'clock in the morning. It can happen at 11 o'clock at night. And our public safety does a really good job, but they get stuck with, okay, what do we do? Where do we go? Who do we call? So we aren't, as a village, we very much respect the homeless community and we want to help them and get them out of this situation. But how can we enable them in order to be able to do that? Where are the resources that we can help to get them to so that they can move forward? That's one of the things I'd like to see coming on it today.
Are there any other comments that you'd like to kind of raise real quick, or I can kind of start answering some of those questions and we can?
Not for me.
Great. So I want to address, I think, is Gary correct? Your question about why are they here and who are they? The answer is they're Brown County residents. Over 95% of the people that are experiencing homelessness in Brown County.
They are Brown County
They
residents?
are Brown County residents.
And what do
Yes.
you have for identification of that?
That's reported of their last housed location. So that would be where they had an address previously stated on residence would be in Brown County. Those individuals that come into Brown County are often coming from surrounding communities in our area. So Oconto County and Outagamie County, those are our neighbors. And those that come into our area, we also see about the same number leave to those organizations or those communities as well. We have this form in front of you, myself here. It's in that packet. I sent it out with you. That's from our coordinated entry dashboard. So that's how we filter in information. So sorry, we were trying this too far.
What page is that?
It's one of the last pages. So if you flip to the back, it's on the second to last piece of paper. One of the back sides of that.
Josh, you said 95%, is that correct?
Yeah, I wish it was on this list, and I have it in other documents, but it's close to that number, if not that number, off the top of my head. Pulling that, and I invite you to come to our pit count in January. We do an annual pit count. That's when volunteers from organizations, community members go out. We go twice a year. The first month, so coming January, it'll be the last Wednesday of January. We'll go out overnight, count those individuals that are having on-street homelessness. We do that as well in July, because that number is different. We have sheltered and unsheltered homelessness numbers that vary on that as well. But that's a requirement that HUD has in place, so the Housing and Urban Development puts that requirement on us for how we receive federal funds to serve these individuals. So that number that you're seeing is here on this piece of paper, kind of that total number. So one of the things that I want to draw our attention to is that first block up there talking about chronic homelessness, not chronic homelessness information. So 800 individuals on our coordinated entry list are not chronic. That means they're experiencing homelessness for the first time or are re-entering homelessness after a short period in between. But most of them are experiencing homelessness for the first time. Are chronic individuals. That's 127 individuals county-wide that are experiencing homelessness for more than 6 months at a time. So that number is not our vast majority of our homeless and our homeless population. So as service providers, we're going out to kind of when we want to prevent that 800 number from becoming chronic, right? Makes sense. That's where we're at. You'll see in our inflow and outflow for that reporting period, and this is a reporting period between October, or I guess November of 2024 to October 2025. We had 907 individuals remain unhoused that entered homelessness or went out. And you might ask, why is that number so high? Where are we going with that? Why does that exist? A lot of that is we end homelessness with housing. So organizations like St. John's, as great as St. John's is doing and all of that, shelter isn't a home. That's a preventative, that's a short term. Those are the pieces in the moment there. So what we have is a shortage of housing in Brown County as a whole, especially affordable housing that is acceptable. So those are where we're seeing that increase and why that number is there right now. Does anyone else want to add anything to that on that?
Thank you. I think, because sometimes we think of this area as more of a small town, a lot of rural areas, it's hard to understand the problem. And I know for sure I was definitely in that place too before I started working at House of Hope. And I just didn't understand how big of an issue Brown County's had. And I grew up around here. But Brown County actually has had the third highest rate of homelessness in the whole state of Wisconsin for over 10 years now. And it just keeps getting worse. So like last year, we found double the number of people experiencing homelessness on the street than we ever have before. And we've also had the third highest homelessness rate as far as chronically homeless situations in the state of Wisconsin. So it's not really a new problem that we're having, but you're probably seeing it more because we just have more people with that experience in our community now. And a few things have happened. Since the COVID pandemic, it's gotten worse. And as everybody knows, the housing market has kind of exploded. There was a correction in the housing market. So even, like my own 19-year-old son has a hard time with trying to afford rent, and we have to help him sometimes. But if you see people out there just trying to make it work and they don't have someone like a parent like what you probably help your kids if you have children. If they don't have someone like that in their life, it's really hard for them to make ends meet because a lot of units are like $1,300 a month for rent now, and you probably see the housing market crisis that we have. In this area, we have in Green Bay Metro, the housing market is less than 3% vacancy rates. And then our rent is actually 20% above the fair market rent rates. So that combination creates more of a homelessness issue. That's why we talk about homelessness being a housing problem. Often at House of Hope, we see that people coming into the shelter already are working, and they just aren't earning enough to actually afford housing in our community. And then because there is such a housing shortage and a shortage of rental units, and rent is so high, it's hard for them to find a landlord that will accept them because they're competing with people that normally could afford to purchase a home, but also can't purchase a home in the range they'd like to because there aren't enough homes available in all income levels. So that's what we see in our community and in other communities like us. If you kind of look around the nation, you'll see that where there's a housing shortage and high rent rates and high housing market rates, you see more homelessness. So that's kind of part of it too.
Thank you. The one, in the document and everything, there was a number of times referencing the COVID-19, Well, why do you think that exploded so much during COVID?
Yeah, that's a really good question, and it was not something that any of us expected. Even in the shelters, just we couldn't believe what we were seeing. But a lot of people experiencing homelessness were afraid to seek services in communal situations, like a shelter. And our homeless systems are like they operate like an emergency room of a hospital. Like you're going to serve the person in the worst shape first. And people were just scared to live in congregate situations. We also lost a lot of our volunteers because they were scared to be around a lot of people, rightfully so. And then a lot of services just stopped. A lot of,
But the numbers seem to go up, and that's just in my mind. I'm like, okay, I understand COVID-19. I understand didn't want to get together and all that, but why did the homeless number jump?
Yeah, it was partly because of the lack of services during that time, the lack of people seeking services during that time. So then they waited longer, their situation got worse. And then a lot of jobs that ended. So like a lot of restaurants and frontline service workers lost their jobs first.
The lower paying jobs. Yeah.
The lower paying jobs, yeah.
Tony Schneider. I can speak a little bit to that as well. So during the pandemic, when we were forced, so St. John's, we split men and women. So historically for 16 years, we were a co-ed shelter. When the pandemic happened, we split men and women into 2 different facilities. And at that point, we started seeing a lot more women come to our women's facility, because at that point, they were no longer even sharing a hallway or a cafeteria with men. So women who were sleeping in their car, maybe unaccounted for during the pit count that happens twice a year, not receiving services elsewhere, were suddenly coming to us because now they were able to go to a safe space.
They felt comfortable.
Correct, and that was a big catalyst for our women's shelter, which is now in its 4th season. And then the other thing too, this is just a little tidbit I got from a Green Bay City Council meeting. When the pandemic happened, we saw housing prices, or not prices, but the interest rates shoot down and sometimes sub 3. I know my wife and I got a place for 2.5% interest rate, and a lot of people at that point were buying these housing units as extra income, supplemental income, whether they were renting it out or moving into it, taking away that stock that was available at that point for individuals to move in, right? So that was also another thing that the pandemic brought about, and why we're seeing somewhat of a shortage. Not all of it's accounted for that, but certainly some of those homes have added to that lack of housing that we have as well.
I have a question. So you said that the people that are in a shelter, they are not considered having a home? So are they part of the 800 that, okay, so we could have, I know I just heard the other day that there was a shelter that has like 175 rooms or beds or whatever. That is part of that 800? Okay.
And so like with that question as well, when you're looking at shelters being, those aren't housed. So like St. John's is a congregate shelter. Often it's a space about this size that you would be sleeping, cot next to cot. It's not necessarily meant for, HUD will use the definition, not necessarily meant for human habitation. So when we look at like how do we solve homelessness, like we solve that with housing, and you'll see at the bottom of that page here, it'll show how many like units we would need to house everyone on this list. So on this list, you have like families, there's children in this number as well. So that's why there might not be a one-to-one number relation, but the total number of units that we would need to have to clear our coordinated entry list to 0 would be 622 units. And that's broken down by different types. You'll see permanent supportive housing second priority, rapid rehousing, and rapid rehousing with intensive case management. So when we look at providing services to someone and getting them into housing, there are some of those individuals that do just need that initial step into housing, and that would be rapid rehousing. It's a short-term help on payments for rent and getting them into that unit, where permanent supportive housing will be much more intensive case management and working alongside of that. We have a couple of different designations of that, like someone who is just entering homelessness for the first time and unemployed isn't going to need necessarily full case management. They just need a little bit of assistance to make rent and have that due, because rents are so high right now. Some of it might need more of that permanent supportive housing aspect. So there's a lot of different ways that we look at that, and that's community-wide. That's not just a Ashwaubenon needs 622 or Bellevue needs or Green Bay needs. Like, this is county-wide. So if we can have and fill those places, we can get there.
So, okay, so my next question is, all of you are in business, well, you work for nonprofits that help people that are in this situation. What do you do, what does your actual unit do to help these people? What do you actually do to help them, to end homelessness?
So St. John's Ministries, and I have a handout too, I think Josh included it, but I can leave it as well, so I don't expect you to remember everything. But we have several different services. The core service that we provide is that emergency shelter option, getting people off of the street, making sure that, especially right now in the season that we have, people aren't freezing on the street. So that is at the core of what we do, providing that emergency shelter. November 1st through April 30th is our current shelter operation period. We have hopes of next summer expanding shelter programming at our women's shelter, piloting that, see how that goes, and then open it up and hopefully do something similar at our men's shelter in the future. Outside of our core emergency shelter operations, we have daytime resource centers as well. Those are both open to the community as well as individuals that are staying with us in shelter. So that's our Wellspring program and then our Micah Center. Both of those locations provide daytime services internally. So we have case managers on site that work with the individual. And I say that, I emphasize that because there isn't just a written in stone a way to stop homelessness or prevent homelessness or solve homelessness. So we work with the individual. Each case manager has a caseload of probably 40 to 50 individuals that they're meeting on a weekly basis to really figure out what is at the core of their situation and their circumstances. So for some individuals, they're struggling with mental health. Let's figure out how we can manage that. Let's figure out how we can manage someone who might be struggling with AODA, a reliance or an addiction on alcohol or substances. A lot of individuals come to us just in hardship. They couldn't afford their apartment. They don't have the family support or the community around them to help them get over that hump. So a lot of the individuals that we see are simply there because they need that next paycheck or they need that month's paycheck before they can get into a new apartment, one that they can't afford. So it's a whole mix of individuals that we see and barriers that they face. With each person being unique, it's imperative that those case managers work with the individual to make sure that when they are ready and when they're able to be successful in a place of their own, that we can get them to that place of their own. And I say that last part because for some folks, to put them in an apartment, in a duplex, in a home of whatever sort, it just wouldn't be healthy for them to have them in an isolated spot of their own, and we wouldn't want to see them come back to shelter. So when we find housing for someone, we also want to make sure that they're going to be successful in that housing that we're able to provide ourselves and with our community partners. So we celebrate things in shelter and at our resource centers. We celebrate things like someone getting an apartment, someone going one day sober, someone that's gone 6 months sober and is now moving in, because each person's situation is so unique to that individual. Now, we also work in our daytime resource centers with community partners as well. So New Cap, a housing provider in the area, they come and meet with the guests and the visitors that we serve on site. We have New Community Clinic coming in and providing mental health checks. They do dental work. They do physical checkups on individuals as far as healthcare and mental health goes. So, and those are just two very specific ones. We have several that come in because that's where a lot of the folks are during the day that we serve. They're at our resource center. So we want to invite the companies in, the organizations in, to meet those individuals and help them overcome some certain things too that maybe our case managers and our staff aren't professionals at or trained at. So it's a lot of working with the individual, building that trust, building that relationship with them so that when they are able to move up and move forward, they're prepared to and ready to be successful. Now, outside of those core things, we have our outreach programs as well. So after Lasting Change is our aftercare program. That's new this year, where we have a program coordinator going and visiting individuals who have been recently housed, making sure that they are successful, making sure that they are doing the things needed to stay in their place and not receive an eviction notice, which, as Josh mentioned, only hurts their chances moving forward. We want to make sure that when that person is there, they are stable, have the resources that they need to be successful. So we have donors that donate items like welcome totes, bedding, furniture, things of that nature, so that's a comfortable place, and they want to stay in that facility or in that housing that they've received. And on the opposite end of that, we have our street outreach program too. And street outreach is another program coordinator in conjunction with local police department, other individuals and organizations in the coalition, going out and engaging with folks who are actively living on the street, unsheltered, unhoused. And a lot of that is also relationship building. What we see a lot of is folks who are hesitant or resistant to services. because of past trauma, past experience that they may have had. So TOLF and members of the behavioral health unit with the Green Bay Police Department, the homeless outreach team, go out and just build that relationship. Also, again, making sure that when that person is comfortable and wants to come to a shelter or wants to engage in some of this programming, they know we're there and we know who they are, so we can jumpstart that process and really get it started for them. And unfortunately, a lot of that is what we see in that street outreach program. Is it's not going out and saying, "Hey, I'm Tony with St. John's. Why don't you hop in the van and come with me to shelter?" Right? That doesn't work. It'd be awesome if it did and if it was successful, but we really want to make sure they're comfortable with us first, and then invite them in and make sure we can care for them to make sure that they're ready to receive that. A lot of that is also just on this handout. This handout here is something that we provide to service providers in the community, other shelters throughout the area, because one of the things that we see are people who just aren't aware of what we do, and someone may get dropped off at our shelter and we just aren't able to provide that care for someone because they need something more like a home, a nursing home, if you will, or a care facility, and we just don't have the staff or the capacity to provide that type of care for someone. But then also just location, hours, phone numbers, who we serve, what we do, so that we aren't seeing people just being dropped off and suddenly they're in the middle of Green Bay without any idea what's going on. So I invite you to take a look at that and utilize it too. Street outreach is something that happens. We serve Brown County, so if you have individuals that you know of that, and I'm sure there's a few people that I've already talked to in regards to, but if there's folks you know of, give St. John's a call. Let us know so that we can go out and interact with that person and engage with them and hopefully help them come to receive services that we can provide or other providers can help with.
So how many of these individuals do you have that are, and I don't want to call them counselors, but are going out and are interacting and trying to, in my mind, I'm kind of seeing a gap. And here, let me describe to you the situation. So I'm going to refer to our public safety chief over here. He goes out to Ashwaubenon Park and he finds an individual out there or a family out there. But what you were mentioning was you just don't want to drop them into a situation. You know, you're not going to go out and just pull them into your van and haul them down there and do that. And I appreciate that. I get that. But there's that gap then, because what does the chief do with this individual? Because they can't evaluate, they can't. So I'm kind of asking, who are these people that, and are there enough of those people that can support that process 24/7 in order to be able to get them to the right spot? And maybe that's where you guys are at, is trying to get that. I don't know.
Yeah, so a little bit of both. That last part, trying to get to that point, is definitely what we're trying to do, trying to accomplish. Right now, a lot of the coordinated street outreach efforts in Green Bay, I not knowing municipalities and things that well, I don't know if it would stretch over into Ashwaubenon or not. But I know in Green Bay specifically, there's several individuals on the homeless outreach team that respond to non-emergency police calls that the police department receives, alleviating some of their staff and services that they might otherwise go out and take care of. That happens during the day throughout the week. Now, Tolef, who is our street outreach coordinator, Tolef is able to stretch throughout the county. I know he's worked with representatives in De Pere and gone out to some of the hot spots, for lack of a better term, in De Pere to connect with individuals, and does that on a regular basis. And that's something that we'd love to offer to you guys as well. I can provide whoever with Tolef's information, and that could be a conversation that we could have to engage with some of those folks here in Ashwaubenon.
Do you have the manpower and that to be able to handle this 24/7?
Right now,
I mean, be dead honest.
Right now, no.
Okay.
We don't have the capacity at this point.
Okay.
I have a question on, like your sheet, you have the St. John's Ministry, it lists all the things that you do for St. John's Ministries. Is there a document, you're from House of Hope, which is not affiliated, I would assume, with St. John's Ministry, then there's maybe other organizations that are not affiliated with you. Is there a good list that you provide or that is provided to our police department, to the different municipalities, listing all these services? Because it tells exactly what you do, which is great, because then public safety goes out and they go, okay, so-and-so has an issue, he fits in this type of help, or this is who I should call. Is there anything, I mean, you have the Wise Women's Group that's out there, you have the new NEW Community Shelter. I mean, you have a lot of things going on, or there seems to be. But how do we get that information so we can get them going in the right direction and contact who we should be?
So I think like there are two things that I would call to that. So we do have a places to go brochure. It's listed on our website. You can access that. We are in the process of updating our website, so it's a little bit more navigable and easier to find and connect to those things as well. At the same time, this is a coalition. So like you've talked about, we're interconnected, but we're not the same organization, right? And so because of that interconnection, it's like things take a lot more time, as you can imagine. As a coalition, we're funded by membership dues, so things like our website design and things like that, those are initiatives that are given grants to be completed and things like that. So it comes down to funding at the end of the day, how we meet a lot of those needs. So to find out places to go, use that brochure. There's a list of all of them. They're broken down by the type of service that is provided there. It's given a phone number, sometimes an address. It's one page, 2 sides. Like it could be more in depth, but if we're trying to fit it down on 1 page and 2 sides, you can only get so much information onto it. The other piece is that all of our meetings are open to the public. We have multiple committees that are open to the public, and anyone can join. Joel comes to some of those meetings and reports out, but we have members of the Green Bay Police Department and the De Pere Police Department that come to our hot team meetings, and that's a great place to connect with our street outreach individuals, those people that are going out. So the Ashwaubenon Police Department is more than welcome to join those. Just reach out. I'll send them the Zoom link or Teams link, whatever we're meeting on virtually at that time. Joel has that as well. So those are open to the public. Those are spaces to learn about where people are getting services and what those services provide as well across the board.
But if I'm understanding it correctly, I'm kind of referencing back to what Tony said. It's not that simple to look at a list and say, okay, this person fits in this bucket and call which one of you guys. So I'm kind of asking, is there something that, is it developed or can it be developed that can help us in our communities and our public safety officers that, you know what, I call this number and that person then sorts out where should this person really go? Because I personally, I don't want to see the chief and his group trying to make that call because I'm afraid they're going to get it wrong. Because to your point, Tony, and I so much appreciate that, you can't just pick them up and say, okay, I'm going to put you in this house, and that's not going to take care of it. They might be comfortable. They're going to head out that door maybe even before the next morning comes along because they ain't comfortable there. I can appreciate that. So is there some network? I get you're all individual.
So the network is the coalition to some extent, and that is our relationship that if you do happen to call Tony's team and Tony's staff arrives and they're like, oh, this is a family, we can't serve a family, I know House of Hope can, and I can make that call, right? So there's we like to say that we're a no wrong doors community, and we try really hard to be a no wrong doors community. That means any service provider that you're contacting will help connect you to the correct one as well, so that there shouldn't be this fear that you're going to the wrong place. And I guess at the end of the day, we're all human beings, and the staff that we're working with are all human beings, and the individuals we're serving are all human beings. We're all going to be making mistakes. We might be stressed out at the end of the day making a tough call, and we don't want to deal with a client or whatever. If we have a perfectly functioning system, that system, whoever gets that first contact, that that gets moved to the right place, that enters our coordinated entry system. So then they get filtered out when housing becomes available to be pulled to the correct place in the thing that moves them to that spot through our system. Like, is the system bogged down with 907 current individuals? 100%. Do we have the funding to house all 907? Probably not. Do we have the staffing? Probably not. But at the end of the day, all of this is going to take a lot of time and care and compassion with the individuals, especially those 127 that are chronically homeless. Those ones are going to be most resistant to services. Having time, building relationship will bring them in to coming. Maybe that first step is St. John's, and then it's building that relationship to being acceptable and feeling ready to move on and deal with maybe my addiction, to go to a transitional living program, which also isn't necessarily housing at the end of the day. That's still a step in the line toward housing. So there's a lot of different pieces within the system that are moving, and how do we get that to function fully and completely? And I think it's, how do we do that community-wide, not just Ashwaubenon, not just Green Bay, not just, wherever.
To add to Jay and Tracy's comments, you people offer, you're telling me you offer a lot of services. When our safety department's out on the job 24/7, and we find these people in places that they're not supposed to be in, at 2 a.m. in the morning, where do they go to get this information that you can take care of them?
So
That's where we're kind of getting around, because you have an 8 to 5 job. They have a 24-hour job. Where do they go those extra 8 or 12 hours or 18 hours or whatever hours there are that you're not in the office?
Well, all of the shelters are open 24 hours a day, 7 days a week, even on the holidays, so they never close. And we do have an after-hours plan through our coalition. And so St. John's and House of Hope is part of that, along with Wise Women Gathering Place and a few other agencies, like Golden House. And you can call any of the shelters and get an actual person who's awake at all times working. So that is part of the system that can help, but I think we just need to take a step back and understand we're all in this together. So these are our community members that were, elected to serve, that were working at nonprofits to serve, that we're volunteering to try to help. So they're people like us in this room that, we're more fortunate that we've not had to deal with that situation, or that we're not currently right now in that situation. So all these agencies are trying to help people gain employment, help people build a healthier mental health for themselves, and get to a place of stability. That doesn't happen overnight. And, if one of our residents is sleeping,
That happens overnight when these safety people are out in the field and get somebody. Your shelters are full right now, so they may get a person at your shelters, but you're not going to put them in there because you're full.
that's potentially true.
Just giving them a shelter for an evening.
But it's our job to fix this problem together. So like homeless services are the most underfunded service and resource in our whole state and nation. Like, it's not like there's a bunch of money in this. We're just doing this to try to help people become safer, right? We're trying to help people become more stable, and we're trying to partner with you on doing that. So if somebody in our community has an experience where they're sleeping somewhere they shouldn't be, that it's unsafe at 2 a.m., and our public safety workers find that person, our police officers and our law enforcement officers are also just humans like me and you. And so are our shelter workers that are also working overnight. We're just all trying to do our best, and nobody has enough time and resources to actually solve all the problems. But no one's gonna come in here and save us. Like, one shelter or one of us at this table, we're not gonna solve the problem on our own. We have to figure out how to do that together. Our community is known, and there have been housing market studies for years that have shown we've needed more affordable housing, and we haven't built affordable housing at the rates required and shown in those studies, and we haven't been paying attention to those. And while we keep doing that, we're going to keep seeing this problem, and it's going to keep getting worse. And we're not putting any more funding towards it, so it's going to be harder and harder to solve the problem unless we can all be on the same team and figure out how to do it together. Because there's not an easy solution to this problem. That's why people are sleeping outside right now. There aren't enough shelters. There isn't enough money. There aren't enough outreach workers.
You see, you're talking safety, and that's what we're talking about. We got 17,000 people to make sure we're safe, that they are safe. And that's our goal here. And that's why we're trying to listen to see where we funnel all this to.
I know you mentioned affordable housing. What is your definition of affordable housing? I hear that term used a lot. And I mean, we have a lot of places that were just built, they're at market for rent. So what is affordable housing?
Well, we should have been building about 600 units every year, and we've only built like 300 in that time frame. So like there's a housing market study that came out saying that's what we needed years ago, and we have only built a fraction of that. And so affordable housing is like fair market rent rates of housing, which our community is already 20% over that amount, and that's just what's affordable. You know, people shouldn't be spending more than 30% of their income on housing. And so that's what I look at as affordable. But in our community, that's just not the case unless you bought your house more than 10 years ago now. The truth is that in our area, we need housing for all income levels. Any kind of housing is what we need now.
So so the affordable housing, you agree that it's built with market rents. We're not talking about low-income rents, HUD housing, anything like that. Obviously, those are a hot commodity and they're always full, but we are all on the same page. We're looking at affordable housing, which is at market rent.
We don't have enough market rent rate housing, above market rent, below market. We don't have enough housing, period. So we definitely don't have low-income housing that's going to house any fraction of the need.
I'm just looking for clarification because we get a lot of people talking about affordable housing. And I always ask them, what is your definition of affordable housing? And everybody's definition comes back to me as low income. That is what everybody seems to be associating that with. So I wanted to get clarification that we're talking affordable housing is at market rent. And I couldn't tell you what our numbers are, but I would assume a 2-bedroom, a market rent, what, $1,200-ish right now? I would assume that would be affordable housing.
That's already above affordable housing rates. But yeah, that's about what it's going to be in our community.
Yeah, but we're just that's just a number that I took out of there. I don't know what that average number would happen to be. But
yeah.
So that would be considered what you're looking for affordable housing.
So HUD posts affordable housing rates on their website every year. It kind of changes every year. And if you look up Green Bay Metro, you can always see what that rate looks like every year. And it'll have like different bedroom sizes, different amounts. But Green Bay Metro is 20%. Our rental cost is 20% higher than that right now.
Is that looked at like for every single development out there, or is that specifically, like, are you taking some of like the really high-end luxury places and putting it in that number? Is that driving that up? I'm curious.
Do you know?
Because we do have a lot of places that are newer, nicer, they're designed that way with amenities to it. Are you guys using that number to come to that 20%?
I believe that HUD comes up with that number. So the Housing and Urban Development assigns it, and they assign it for communities across the country. So they do that for each one, and I'm assuming that they take the entire market and have that put in their math. That's just my assumption on it. And going off of what Shannon said with housing, when we talk about all housing, that means we want we're looking at having people move from who have been receiving services. They might be housed right now and they're in a space that they could move up to and upgrade to. They just don't have that ability to move that next step, that next housing level up, which would vacate a spot for someone else to move into, right? So if we have a healthy housing market with people moving across the board to single-family homes or townhomes, or that another term that gets thrown around is that missing middle housing, that first-time home buyer housing option that we've had when I was a child, born in the 90s, my parents were able to buy like single-family home and enter into that middle market that we get to move into for that next generation of family and housing owners, right? So that's across the board housing, because when someone moves up, we open up a new spot for them.
It should be 5%, at least healthy communities need at least 5% housing vacancy, and we're under 3.
Do any of your organizations build properties?
We have 15 units.
You have 15? Because I know NewCap, I don't know if they still are, but I know that they had been building units for everybody. I don't know how well that's actually
So
worked
I
out.
don't know, I can't speak for NewCap as not part of their organization, but I know that they have a history of building organizations. Another, or 2 members of our coalition, which aren't present here, are our Neighbor Works and Brown County Housing or Humanity, what is that? Habitat for Humanity. Both of them are part of our coalition, and both of them are heavily engaged in the development market. I know Neighbor Works has just opened up 2 units side by side, and are already looking at offers at that. And there's another set of offers there. And another part of Neighbor Works programming that is coming up is a initiative around a community land trust. And so that is looking at basically the land underneath that being owned in a trust to keep the housing rates low, so that when you purchase that house, you're purchasing it below market rate. You can only sell that house below market rate, things like that. And so you can have the equity of being a homeowner, but you keep that land underneath of it in a trust, and that keeps the property rates a little bit lower.
How has it been working with landlords? Are you getting, I guess, how's that been going for you guys?
Yeah, so we spend a lot of time throughout the coalition specifically targeting landlord engagement. We have a work group specifically identified towards engaging with landlords. It's a key component of what we have to do with the Housing Authority. So as the Housing Authority, we don't own any property. Our program is 100% predicated on that partnership between the tenant and the landlord out in the rental community, the rental market. So that's just specific to our program, but all of the other programs throughout the community is landlord engagement is integral in that, and we've seen some progress in moving forward with landlord engagement. Obviously, like Josh has said, it's a long process. You know, it's 2 steps forward, 1 step back at some points, but the biggest component for us is continuing to engage, addressing issues as they arise, providing that instant feedback rather than, you know, having their voice at the table has been a huge component for the success that we've seen recently.
So if I start breaking this down, I see an inflow. There's multiple components. You guys well aware of this, but for my education, correct me if I'm wrong, I see an inflow issue, which is kind of where our ordinance was coming from. And yeah, there's somebody you can maybe call, but we haven't successfully, from our public safety and that, been able to get a hold of somebody in order to do the evaluation and that. So that's one piece. Then you guys are very much involved with that middle piece of, okay, we got to get them the right help. We got to get them to the point where now we can move them into housing. And that's, I see, the third piece then. Because now once you finally, whatever their issue was, whether it was a financial, jobs, whether it was alcohol and drugs, whether it was mental illness, whatever it was, that's where you guys really have a lot of focus on. Not that you don't focus on the other area, but you really focus on that middle. How do we get these people to be more productive? And then that third piece is getting to the affordable housing. That piece right there, that's good, but I see that as one that we need help even way above and beyond what we can do here. So I don't know where that's going to, but am I correct in kind of the way that I am thinking of this right now? Because I'm looking at it from our village's standpoint. Okay, It's not like we ignore the other piece. You kind of got the middle piece. It's not that I'm ignoring in what Chris was talking about, the affordable housing piece. That's something that we can have an impact on. But the inflow piece is where I see that we've got a kind of an issue as to how do we get that evaluated? How do we get them to the right spot? How can our community be calling, our public safety be calling that right person in order to make that happen in a timely manner type of thing?
We have the people that they can contact right away, but there's not a solution right away because our system is bottlenecked,
Okay.
you know, because there's not enough outflow. There's not enough housing for them to go out to, so they get stuck.
You get stuck in
Right,
the
and-
middle ground.
Yeah, so
Gotcha.
Jared is actually one of the people who work with House of Hope, who work with landlords. And we have people who are professionals on our team at helping people find housing and helping work with landlords and helping to mitigate some of the issues that landlords might have. Within the coalition, there's over $3 million of federal funding that we bring into our community to pay local landlords to help them to be able to rent to people that are higher barrier. And then in the units that shelters own, in the housing units shelters own, we serve the highest barrier, hardest to serve people that you might find sleeping in a doorway of a business otherwise. That's who we're serving in our units because landlords aren't going to rent to them for whatever reason, various reasons. But because we don't have enough housing stock in general, there's not a place for people to go. We don't have enough shelter space, and that's one of the most expensive ways you can help someone, right? So it's better to help someone get into housing. There also are a number of students experiencing homelessness in our area. Like I just looked up numbers while we were talking, and there was 22 students in Ashwaubenon schools 2023 and 2024, 19. Last year, over 300 students in high school that are experiencing homelessness in Green Bay Public Schools. So that's in 2024, 1,284 kids experiencing homelessness. And we have families that are just doubled up. So I feel like for the future, this is still going to be a problem if we don't figure it out, if we don't make sure that we stay on top of this and get a good system to going. But as far as an inflow system of people on the street experiencing homelessness on the street, getting someone out there, I think we can triage a situation and, work with local law enforcement and municipalities and, talk to people. But, like Tony shared, you can't make someone accept services, and sometimes people that have extreme mental health concerns may potentially refuse services even though it's unsafe for them. In most cases, what we see is that it's not necessarily unsafe for service workers and community members. It's more like unsafe for that person is feeling unsafe themselves to go somewhere and receive services.
When I did talk to an individual who is involved in the homeless community, and she told me that actually our ordinance that we had talked about, which is what brought up about all of this to begin with, would have actually helped the homeless situation because it would allow our officers to engage with people much better. So I thought that was an interesting comment. I know.
I would be curious to know, I think that there is, for federal funding and things like that, you can't have things on your record. So when it comes to any form of ordinances or things like that, there's a lot of fear about having those ordinances in place that are going to lead to unpaid fines that are going to move and progress up the structure.
When you do any kind of an ordinance, you always have to put a fee structure with it. That does not mean that we had no intention really of citing people.
Don't think we're looking at income from housing.
No.
Sure.
Not the point of
But,
our ordinance.
no, that was not the point of it, but you have to have a fee structure with your ordinance. But that,
So I think like if to get to the root of this, then to get to the thing and a question that Gary has been pounding of like, what do we do at 2 a.m. and someone is out? My question is that person unsafe to others or themselves right now? And if that person is threatening themselves, threatening the life of others, there are steps that the police can make already. It doesn't, an ordinance doesn't need to exist to have someone get connected with services or make that phone call to St. John's, or even to have that police officer necessarily, you know, talk to someone. If there's a call coming in because someone is sleeping under a bridge, you know, correct me if I'm wrong, your police officers have to make that first initial direction. So they make that first contact. That contact can then become a referral. We can build that community trust or that partnership and put that in place of an ordinance and things like that. So, like, for an example, other organizations and other communities have much more robust street outreach programs where their street outreach teams are being that first response team, even more robust than what we're doing in Green Bay as itself. And we can collectively, as Ashwaubenon, as Green Bay, we can put effort into that together and take those steps to make that something that happens. If we want it to look like something that is overnight, whatever, we can start those conversations as well, and that would propel things and push things to that next step.
I do think it's, you know, if you look at studies about camping bans and things like that, you'll see that it's actually, it doesn't help. It actually makes situations worse for people, because then you're incurring costs to them, you're making their situation worse. And it's not like they have anywhere else to go. That's why they're here now. It's just making the situation harder for them to get out of a homeless situation than anything else. So, like, you putting an ordinance in place is just causing more harm to people than good. And statistically, you could see your homelessness numbers rise slightly even with a ban like that in place. And that's what studies show.
Do any of you guys have people that come in that your programs just won't help at all, just for whatever reason, drug use, something like that?
I think in situations where someone's really violent, that could be a situation where, you know, if an organization tries to help someone and they're assaulting someone, then we would take other action.
So it's a yes then. I would assume that goes for everybody. I know for sure you do. So then those people, how many of those people are on our streets?
So if you have someone who's breaking the law and physically assaulting people, then the police would be involved. And I think that's a whole different issue than homelessness.
Well, that's kind of where I'm going with that, because like I think our ordinance was more geared towards like that type of a situation.
It may be geared, maybe that was your thought process, but it's going to affect everybody. It's not going to affect just the one violent person that you randomly came across that one day. It's going to affect everybody. The majority of people experiencing homelessness in our community are not violent people that are trying to hurt people. It's a fear that people have that's not a real.
Can I interject? This is Ashley Lahaki. I'm one of the village's attorneys. Can you hear me?
Yes.
Okay. You know, I had obviously a hand in drafting the ordinance. And we recognize that homelessness is a real and serious issue. You know, I don't think that there's anyone that wouldn't, probably in that room, that wouldn't say they share that concern for people who don't have stable housing. The purpose and the intent of the ordinance was never to punish homeless individuals. But camping in public parks poses health, safety, and sanitation risks, and the village has an absolute responsibility to address that. You know, I think without enforceable rules, individuals camping in parks can unintentionally displace all of the other users. And that's a concern that certainly, you know, was at the forefront of my brain when we were going through and trying to figure out how we could word this. And so the village has an absolute obligation to balance the rights of everyone who relies on those spaces. You know, our goal is voluntary compliance, and enforcement typically involves warnings, referrals to services, connections to local agencies before citations would be issued and before they could really be enforced in court. So I think that it's a really narrow view, or we would be taking a very narrow view by saying this is an ordinance that would punish and would harm homeless people only. It might exacerbate the problem. I simply don't agree with that. In order for us to ensure that our parks are safe and that they can be used by all of our residents, this an ordinance, by adopting an ordinance, is really the only way that allows us to go in and to say to someone, you cannot continue to use the park in this way.
Are there ordinances on the Ashwaubenon books against drug use in parks?
I don't know what that has to do with camping in a park.
So what I'm getting at is that there are other avenues for enforcement of symptoms of homelessness versus the criminalization of that person experiencing homelessness in the first place.
Well, and an ordinance isn't there's no criminal statute here, right? It's a civil matter.
Sure.
So there is no criminalization of homelessness through an ordinance, and there's recent case law from our Supreme Court that affirms that.
You, like, as is your right and Ashwaubenon's right to continue to and choose to enforce a camping ban ordinance, there are just other ordinances that have more, I think that the phrase that has been used, teeth, to give officers more of a handle on enforcing harder and more intense things and use pieces within the park.
Yeah, we're not looking for harder and more intense. We're looking for
fair.
long-term use of our parks for camping.
And we can solve that through collaboration and building like a system and structure to walk.
I agree,
ourselves
but I don't think that having an ordinance in place prohibits or prevents that coordination. And that's really what we're getting at here, right? In order for the village to go in and to say to someone, you cannot camp here, they need to have an ordinance on their books that says you cannot camp here. It does not prevent us from coordinating with other agencies or making referrals or warning someone before a citation is issued. But without having that ordinance on the books, we simply cannot say to someone in our public park, you cannot be here. Unless, like you say, they're doing drugs or violating some other law, but hopefully that's not the case.
Mm-hmm.
Well, and the one thing that came up when this ordinance was at Park Board is we already have ordinances on the book that can take care of some of the stuff. There's no tents. You have to get a permit. You can't stay in the park after 10 o'clock at night. So there's already ordinances in place that can help some of this stuff. So it's like, do we need that one? Maybe, but there's other things in place that public safety can go out and take care of with ordinances that are already on the books. So I think that was part of Park Board's reason for denying it, because they felt that it was covered by other ordinances that were already in village ordinance. So that was one of the things they brought up.
I think for enforcing the ordinances that you already have within your parks exists to be that piece to help build that. And then, when the morning happens, at 8 o'clock a.m. happens, that person has someone from St. John's pulling up to talk with them, right? Those are those places where we can build that coordination and those things to take that next step.
Although, I'm sorry, Tracy, if I could just interject really quickly. So although this is certainly pertinent and relevant to the conversation as a whole, I don't know that debate or deliberation over the previous ordinance was necessarily the topic. It's certainly relative and can be discussed today. I don't want it to be construed that this is not a topic that you can discuss. But I don't necessarily know that this is going to be beneficial for today's conversation to debate the validity of the ordinance that was presented before. Absolutely. Per se. Yeah. But I do want to just kind of make a quick comment, because we talk about camping in parks and ordinances in place that we presently have and the impacts that may have within our park system. It is true that we currently disallow camping in our parks. What the previous ordinance proposal would have done, it would have clarified what camping truly is. Our ordinances presently do not clearly define what constitutes camping. So the proposed ordinance talked about a different definition of what camping is and what elements constitute camping, like tents, sleeping bags, things of that nature would further constitute or define camping. But in addition to that, it addressed other public areas. So it is true that our ordinance does restrict camping in parks. Our ordinance don't clearly restrict or prohibit camping in other public areas or other public lands that the village currently has and maintains. Those could be things like a stormwater utility pond, or property surrounding that utility infrastructure, areas of right-of-way. So if somebody wanted to set up an encampment within public right-of-way, currently we do not have a prohibition against that. So the idea behind the ordinance was to take what we currently have, further define it so that it's clearer, but then also extend it beyond just parks, but other public lands that the village maintains, controls, and provides to the community. So again, I don't want to get into a debate about the ordinance, but I just wanted to clarify, because I think we spend a lot of time about this is a camping ban in parks. We currently prohibit park camping. This would have extended it to other public areas controlled by the village.
I think the other thing to note is that although I sense a lot of frustration maybe, and it does feel a little bit like an argument for some reason, but we're just here to be supportive and share data with you and information with you that we have and that we know. We're here to be on your team to help you with these things. So it did seem like the conversation took an interesting turn. But I was kind of curious to hear from your public safety about what, if you could share what you think your barriers would be without some of these things in place.
Sure. My name is Tom Rowling. I am the interim chief here at Public Safety. I've been here many years, and I can certainly firsthand express some of the homelessness that I've seen in my career, not as an administrator, but certainly as a police officer. And I think one of the biggest things that we see is that the people don't want to be disturbed, interrupted, or helped. And what I mean by that is that they're fine. They tell us that. But just like you said, we're human beings. And we know what it's like to have a family, have a home, to be loved. We see that it's not that way with these people, and we do try to help them. And I think the concern here from the village board, from the members, is that we try, and at 2 o'clock in the morning, we are out of sometimes options. We call and we get a voicemail. We get a busy signal. We get someone that says, can you bring them at 7 o'clock in the morning when we have someone here staffing and so forth. So we believe there are resources. But I can tell you right now, there's a gentleman that it's not a complaint, it's a concern. And we talk about this. The concerns come in daily. Check on this person. And we go out there, and this gentleman's right on Oneida Street, and he's in a bus stop, and their concern is there something wrong with him, physically, mentally, medically, and he just wants to be left alone. But yet we have people who will stop by and enable him with things, so he has learned, like someone that's trained to say, I know what it's like to get my hand out, so I'll stay here because I'll get that. We've tried to offer him resources. He doesn't want them because he knows I'm getting a better life by people just giving me something right here. So I think that's the question, is that we just get a lot of complaints, a lot of concerns from people saying, you need to do something for them. And they look at us saying, you're not doing anything for them, but these people don't want that help. And I don't say all of them. A lot of them, I think, are very disappointed in themselves, I think, or discouraged to try to get help because they don't want to be a burden. And I think that's kind of why they're on their own. But our officers are very empathetic and compassionate to this, because they know they're trying to help. But how many times can we also be told, leave me alone, you can't do anything for me, I don't want you to do anything for me, you're harassing me, and we move on. So we can talk about not being in the parks and not camping, but we do realize they're right there in our streets, and we're trying to help them, and they don't want it. So like you said, we're here to learn. I mean, if you can tell me here's the magic pill to give them, then this is what's going to happen, we'll all be out of here. But we know that's not the case. So we know it's a struggle, and we're there. We're certainly there trying, and we're not going to stop. Please understand that this isn't something we know it's going to go away, but we're trying to make sure it's not just here, because we know it's Ashwaubenon, De Pere, Pulaski, right? It's all over. We know that.
Yeah, thank you for what you do. We appreciate that. And agree. We're in the same place as you, where we feel like there's, if people have human rights, and you can't force someone to make a good choice. sometimes that might be better for their well-being. And there's nothing you can do about it. Sometimes you can't make somebody receive help. So sometimes we just have to help people and do the least harm we can do. But
And-
we're in
and
the
I
same
think-
spot sometimes.
And I think that's what, I think is the concern here from our village board, is that they get the complaints that we're not doing enough from constituents going, hey, why is that person still there? And our hands are tied. Our village attorney gives us, hey, here's the direct way to handle it. And we're trying to make sure, we're holding people accountable, number one, but yet making sure that we are holding ourselves accountable by treating them that same way with dignity and respect.
In some cases, putting in the ordinance then gives them that ability to be able to, even though they don't want it, to actually get them to you guys. That was part of what our hope was. That it absolutely didn't get interpreted the way that what we were trying to do with that ordinance. But I still see a gap in being able to get our public safety officers the right information to make the right phone calls. And that, I would say, you guys do a lot of great stuff. Don't get me wrong. And I so appreciate it in our community that you're doing that. But I still feel like there's a gap there, that we still are gonna be in that same situation. Whether we put the ordinance in or not, ain't gonna matter. We're still gonna be in that situation where who do they call? And to me, that's the step to kind of help to get this whole process, and I get the back end part of it on the outflow. Your point's well taken, and there's not much that we can maybe do about that at the moment, except to continue to work at it. But I would really like to see something on the inflow side to be able to, so that so when we put in an ordinance like this, that we then have the right enforcement process to be able to enforce that, because the ordinance isn't there to punish. The ordinance is there to try to get people the help that they need.
So to make a proposal then on our end on what I think this could look like. So the city of Green Bay right now has 2 staff members under their employment that do outreach. They do case coordination for homeless individuals, the most chronic homeless individuals. Brown County, I believe, has 2 as well. For me, it makes sense to not Ashwaubenon make your own version of that person, but have or figure out and get to the local politics side of things of how do we make this agreement so that city staff or Brown County staff are actually coming in to be that person and building that relationship. And maybe it's a contract for one like staff member that you just brain is running and I don't have the exact number, but here's the salary for a staff member that Ashwaubenon pays for through Green Bay. I don't know your budget by the back of my hand. I don't know what that would look like. Obviously, those would be next conversations. But I think that there is space for us to, and as a coalition and as service providers, to bring those partners together to have those next conversations, and especially on the inflow piece and building relationship. Pete and Jeremy, who work for the city, they have a lot of really great success with getting their most chronic clients not necessarily housed. Some of them are housed, but having even that next step of transitional housing or treatment and things like that. So that would be I think the next logical step for this conversation would be looking at how do we make that or make a formal agreement along those lines of what does that look like, and maybe that's even bringing in De Pere and the other municipalities as well, because they're also in the same boat as Ashwaubenon.
You know, what I'd like to say, so going through the information that you sent, good information. I don't see any numbers on the successes. I would like you to shoot me an email about what are the successes? That's what I kind of started this whole meeting with, is what is the coalition? I don't know if I am saying this right, if it's the coalition, if it's a group of people, what is your goal? What are you doing to help end homelessness?
Yeah, so that, on the sheet, there is the line graph that goes across near the bottom. Here, this looks at our permanent exits over time. So it gives you each month how many people from our coordinated entry list are exiting to permanent housing. And so just in October, we had 61 individuals in our coordinated entry system exit to permanent housing. So like, we've said it before, the faucet is on, like people are entering homelessness at a rate faster than our drain can drain, and our sink is overflowing.
You know, Josh, in 30 seconds, tell me how you get from 54 to 61 when a person has nothing at the start, and at the end, you got them self-sufficient in a housing. How do you get that done?
How do we get that done?
Yeah.
So that's relationship, that's coordinated entry, that's bringing that person in, that's building that relationship with their case manager, that's having the correct funding source that we can have in finding them the housing unit, the landlord, whatever it is that they are able to exit to, if they're taking a voucher, if they're taking one of the permanent supportive housing vouchers. We're moving them through that system. They're all doing work. Lots of them are having jobs. Some of them are on disability. They're on fixed incomes. So then they're already falling behind because they're not able to make a fixed income that's going to be 30% of market rate rent. One of the things that isn't pulled out in the data is like the ages of those individuals that are experiencing homelessness in our community. We're having a huge increase of individuals that are 55 and older experiencing homelessness in Brown County because of fixed incomes, because of changes to Medicaid, and having serious medical issues that put them into needing health care, and losing, like there's an individual who entered healthcare or the health system for emergency, lost his housing on a fixed income, and exited the hospital because of losing that house and into homelessness. And this is a broken system, and that's why we're working to fix it. But that's where, you know, we come together to fix those gaps, pulling that person and building that relationship and having someone be able to provide services directly here in maybe that's in partnership with your police department or like where your public safety, however you want to make it look like. I think that those are the next conversation pieces that we can build.
Josh, I took one of those people from peeking into my window at a rental property to not having nothing and a child to boot. I took him in on a chance. He had assistance housing, couldn't pay the full rent, but I gambled on him. 7 years later, I still have the same guy paying me rent, wanting to buy the place.
Nice.
And I think that's more common than it sometimes looks like.
Not on my end. This is on a personal side. This is where I run into issues, is that we get an individual, let's say he moved into the area, and he's homeless, and you guys place him and he gets put on a voucher program. A guy like me comes along and I rent to him. He's good for a year and a half. Don't really know his history, can't really ask him. All of a sudden he starts doing drugs again, falls off, trashes my apartment, and leaves it an absolute wreck in excess of $5,000 in damages. What do you guys do to watch that so it doesn't happen? Because I've had 5 so far and 4 have, that's how they've ended.
Patrick, do you want to?
So I've always, and I'm gonna actually, because I'm afraid I won't get the opportunity to say this, I've always wondered why none of these facilities actually approach landlords and rent the unit with their name on it and put their security deposit behind it. So that way, when this happens, it doesn't land on the landlord. Because there's nothing we can do. You can go and take them to court. You're not gonna get anything. They end up, at that point, coming back to you, and then the cycle repeats itself. So what do you guys do to actually manage that and watch it? Because I know I have one person still on it. Does great, but you don't, you see him once a year when you inspect my building. That's it.
Are you talking about the Section 8 housing voucher program specifically?
Well, I mean, they're assistants in just different, multiple, but this one specifically, yes.
Yeah, so admittedly, our program, the Housing Choice Voucher Program, Section 8, is probably the more limited in terms of our ability or our capacity to monitor those situations. Honestly, there's a lot of information that's changing within HUD. There was opportunities previously where we could review background checks during time of during their tenancy. That was removed a couple years ago. So we don't actively do background checks currently. There's talk of that changing again. But in terms of like going into the units, you're right. We're in there every 11 months for the inspection of the unit. One of the limitations, like I said, with our program is that our funding is not in the same manner as some of the other agencies that are around the table. Our case managers or our specialists that are handling that are handling the administrative side of it. They're not case managers. They're not, they're handling 300 to 400 individuals on a regular basis, where, case managers who are more in-depth actual case management and aware of each individual situation, they're handling a much smaller caseload. With our program, we don't offer security deposit assistance simply because we don't get funded security deposit assistance. Our dollars directly from HUD are very specific on what we can do with them, and security deposit assistance is not one of those. Unfortunately, we also can't help pay for those repairs. There's talk through the blueprint of landlord risk mitigation funds that we've worked to establish throughout the community. Salvation Army is spearheading that right now, so that's an avenue that we're trying to pursue because it comes along with a lot more intensive case management as part of that, and that allowing landlords to take that risk like you're talking about, right? Where it's a higher barrier individual who, you might be in a position of higher risk for damages or unpaid rent or whatever the case is. That Tenant Success Fund through Salvation Army is targeted towards those individuals. Again, it's a pilot program that they're establishing. The scope is smaller than we'd all like, just because, again, as we've all talked about, funding is a huge barrier for all of our programs.
Question for all of you is, funding has been an issue in the paper for anything. Is your funding being reduced at all from what the norm is, whatever that is?
Yeah, I can speak on behalf of St. John's. So we don't receive any government funding of any sort. We are all, John and Jill down the road sending $5 a year, so-and-so sending $100 a month. We're all community-based, community foundation funded. So our funding relies on the funding going to a foundation that might be awarding us a grant, but then also just simply cost of living and increases there. We've seen a decrease, an increase. It kind of just fluctuates with where the world is at right now, where the country, the city, the state, all of that is at right now for us and the individual that's able to provide that care for St. John's Ministries.
Hi, I'm Beverly Scow from Wise Women Gathering Place, and we support 13 households with government funding. And
Is that your capacity then?
for
13?
13 and their domestic violence, for people who've been harmed by domestic violence, and through 2 different funding sources, we have that. And we've been able to build some really good relationships with landlords. Through those funding sources, we provide more involved support for the residents, right? We're in the house at least once a month, and a lot more in terms of connecting and supporting them with whatever have been the blocks for each individual. And it's very different. Each family has different needs. And so we kind of start where they're at and try and help support them. Sometimes it's just getting their medical stuff taken care of. Sometimes it's substance use. Sometimes it's mental health. And sometimes it's just basic life skills. We have a healthy relationship program that builds skills for relationships and healthy decision making, knowing how to set a goal and accomplish a goal, like basic life skills. We've been able to provide and support our families with, as well going shopping with them and helping them stretch their grocery allowance, their budget for the month to more basic stuff, how to cook rice and beans and things instead of just processed foods, right, all the time. So there's ways to stretch the limited resources, which is the other end of affordable is we have a lot of people we also run safe parking, and we have people who are working who can't afford rent because the wages aren't living wages that they're able to get. So there's the two ends of affordable housing and then a living wage to be able to afford it. We've got people at safe parking who are on, limited incomes, disability. We've had students at college staying at safe parking, families, the whole range of people. And when you say like starting point, it took a while for them to get to that point of being like not housed and things happened to them. So like finding ways to support their healing. We have some different programs that we do that are culturally based, but anyone can come take a part of them to support the healing, right? Things happened and also harmed them and got in the way of their ability to handle life in this world. And so one of the first things is to know where you have a place to sleep and eat, so then you can get out of crisis mode and kind of then focus on the healing and the skill building and putting those building blocks in place. And sometimes it takes time. It took time for them to get to that point. I think this community I'm sure you play a role in helping attract development so that there's more housing in this area. That would be really a part of the equation, I think. And then this partnership of, in the meantime, triaging, right, the needs. And I like that our network, our coalition has people providing services in a lot of different that address the needs of different parts of the homeless community, right? They're not all just one type, right? They all have different needs, and they're at different places in their readiness to take on their own apartment. And so safe parking is one of those places in the continuum. They can come to us. We're one of the no wrong door. They will get them entered into the coordinated entry system. They're all welcome to our services at Wise Women Gathering Place to support the groups, to support healing and wellness. 45% at Safe Parking are eligible for our VOCA funding, which is Victims of Crime Act. So something happened to them that made it so that they're in this place of vulnerability and needing support from community. So I just wanted to get a couple of words in, and we're busy. Like safe parking, we started in COVID. In terms of the COVID, it revealed the hidden homeless in our community, people who were couch surfing from family to friend, and that 2-week guest policy that most landlords have collided with that incubation period as we understood it with COVID. And so we thought, well, if they have a car, they could at least be contained. And we discovered we're 5 years going. We found a gap, this community, that we need this resource. It's not ideal, right? We want to get them to where they can have their own place, but it gives that people that are wary of communal living sites, right? If they have a car, they've got a little bit of security of this. I can lock my doors. And when we first started, people were wary, right? This is going to be the drug, whatever. And I went to all the neighbors around and said, here's my number, here's our 24/7 number. Let us know if anything happens. And we initially had safety monitors on site the whole time the parkers were, but that's not the need, right? They've built a community. They value the fact that they can park and be at a place that's safe. They have resources, access to resources. They have support from each other. If somebody's battery dies, there's, a range of people, communities coming, bringing hot meals, different nights of the week. So we've been really pleased with how it's gone. And there's bumps, right? And there's things where, but it's really been a success. But it's every year it just keeps growing each season. And so we hit capacity a few nights this summer. We have 46 spots. And this winter we're at our high, still high at 35 cars a night on the lot. But it's one piece, right, of the solution of many different people providing different aspects that are going to help people along the way. And we're appreciative that you're wanting to be a part of the solution, and we all play an important role.
Where's your parking spots located, actually? I've heard before, but I can't remember.
We kind of, because some are domestic violence, and so we don't advertise. So our phone number is what we advertise, and then that way we're aware of who's coming to the lot. We've done an intake, we know some basic information about them, and can follow up occasionally, like word of mouth. There's some people who sneak on the lot, like after a safety monitor's left, but we have cameras, and we have electricity on one side of the parking lot that they can plug into, and we also provide portable batteries that we charge during the day and bring out at night, so people can charge in their electric blankets or their device or their CPAP machine, whatever their needs are. So
I have a question on housing, and Aaron, maybe you can answer this. The workforce development housing and the low-income senior was built through some HUD funding, is that correct?
The Berkshire Ashwaubenon, is that the project? That was funded through some low-income housing tax credits through the state.
And is there specific areas that money can be spent in only? Is that correct, or am I wrong on that?
Yes, there are. They have qualified census tracts that.
Very little spaces like that in Ashwaubenon, is that correct?
Correct. There was, it was kind of a window in time that we were able to fit that project in. It does depend upon the census. So I think, right now we're in that window yet. Yep. But considering the redevelopment that's occurred within that census tract, I'm not 100% sure that will be a qualified census tract in the future.
So the possibility in specifically Ashwaubenon getting some funding in the future may not be a possibility because of census tract and that money, and us not having an area like that. Is that correct?
That's correct. There's been some movement at the state to try to, state and federal levels, to open up those census tracts a little bit. But as it stands right now, we are limited to that one tract that may or may not still qualify after the crazy but 2030 census.
So really, the housing, obviously, so Jay made a really good point of that. You guys kind of working in the middle, but then we can't get them into housing because we don't have enough. So then you have the whole census tract and all of that, and the funding available from the federal government to help support that housing. Are there developers, and maybe you know or you folks would know, that will take on low-income housing developments? Is there a way for them to do that and financially be able to support that and have that
I
available?
will answer this question. I want to get back to Gary's question about funding, because you had asked about funding coming in and how organizations are doing regarding that. So we currently have $3 million coming in via HUD to Brown County to provide services. That funding is cycled through what's called the Wisconsin Balance of State Continuum of Care. So that covers the majority of the state outside of Dane County, Milwaukee County, and Racine County. Those counties are their own individual COCs or continuums of care. HUD distributes that fund that way, so that's just how they've been doing it. That fund is announced in a cycle. They call it a Notice of Funding Opportunity, or a NOFO. That funding was announced as a release in a 2-month cycle this year. They announced it in the beginning of November to have it finalized by the end of January, mid-January, and they had not even put the application or gave the application to the Balance of State or any of the COCs to complete, only announcing that they were going to cut all the permanent supportive housing programs. So a lot of the programs that we have people in, the 13 people that Bev has in her rapid rehousing domestic violence program would have been cut completely. They were going to cut from 90% of funds that were going in for permanent supportive housing down to 30%. So there's a lot of uncertainty for our organizations as well going forward with how are we going to continue to support people. I know Shannon had mentioned that she'd already had people transitioning into different funding buckets too, so to keep them housed if that funding cut was to be called back. And earlier this week, HUD said, oh, we're not going to actually fund it with this funding announcement. We'll give you something else later, and haven't announced when that is going to be. And I think we're all aware that the government could shut down at the end of January anyway, because that's when they punted the ball to, right? So that's kind of the situation that we're operating in as organizations. And when it comes to developers in the area, we do work right now with our Housing Development Committee, and we've been looking at like what are opportunities to bring in developers to our community and things like that. And in a big, we've harped on it. I just mentioned funding. Funding is another big piece of that. It costs a lot of money to build developments, large developments, middle developments, all of those things across the board. And we're looking at how do we incentivize of those and build that in. So it's looking at zoning policies, like do we need to look at how we zone certain things, building opportunities. So other communities have created loan programs. So they've had organizations, so in Sheboygan County, they have Johnsonville and I believe Kohler Company and one other large company in Sheboygan County have all pulled like funds together into this like low interest rate loan that will go out to developers to build single family housing units at low income, like below market rate. So building it, and it's all trust land. So that goes back to that trust piece, is that those houses can be bought by employees of those organizations or other employees, but they cannot sell that property above market rate, or they can't just turn over and just like flip it and whatever. So there's a lot of restrictions that go into place. So there's like other things that are happening in other communities that have been really successful. Like in Green Bay, they've been continuing to use TIF funds, tax incremental funds, to kind of incentivize low income development programming or development building there. So there's a lot of opportunities to engage with that, and it's finding the right space for the coalition to do that, or where we want nonprofit to engage with that, or how do we want community partners to engage with that.
Okay. Does anybody else have any questions? We got a lot of information. It's a great meeting. Thank you very much, everybody, for coming in. And we'll move on to number 5. Items for next agenda. Our next village board meeting is next Tuesday at 6 o'clock. It's the final one of the year. It's the final one at 6 o'clock. And that's, if you have any items for the agenda, call the staff. I need a motion to adjourn.
Motion to adjourn. Second.
And second to adjourn. All those in favor say aye. Aye. Opposed?
Thank you.
Carried.
Thank you.
Thank you.